Good afternoon and welcome to the Wavy Digital Desk. Today we're going to be speaking about a CDC report saying vaccination exemptions have risen across the country, including here in Virginia. CHKD Pediatrician Dr. Mitchell is with us and he is going to discuss what is going on and how important immunizations are with us today. So Dr. Mitchell, thank you so much for joining us this afternoon.
Thank you for having me about this important topic. I appreciate the time.
Absolutely. I mean, just to jump right in, how important is this report or is this staggering to you? I mean, what are some of your first thoughts?
Well, after reading the report, it's nuanced a little bit. And so, yes, the vaccination rates of entering kindergartners is what it refers to, have decreased over the last couple of years. Remember, that's coming off the tail end of COVID or whatever we're calling this today. Um, and that's a combination of rates have gone down, but what they also reported on is the number of exemptions requested by entering kindergartners has crept up. And so that's a trend we don't want to see continue. We have a goal to hit 95% immunization rate across the country, and we're slipping away from that rather than getting closer to that, I think is the significance of this report. Um, Going into more detail, it's a downward trend. It's a downward trend for Virginia, but Virginia is better than the average. And so that to me, that was encouraging as I read that sort of detail that we're better than the average in the US in number of percent vaccinated entering kindergarten for those big important vaccines. And we're less than the average in the number of requested exemptions for entering kindergartners. So um, that trend is not a trend we want to see continue.
Right. And as you pointed out, it's higher in other states than it is in Virginia, although Virginia does have a slight increase, it shows in that 2022-23 year. But there are some states that are at 5%, and I've seen even 10% in some data reporting, I think, from Idaho. So those are pretty significant jumps.
Oh, absolutely. And that's worrisome in some areas of the country. Absolutely.
And then, let's, to bring it back, the importance of immunizations, and we can bring up some data that you've pulled for us in just a bit. But, just to speak to the fact of what's affecting this, they are important, data shows that, and we'll get to that. But what's affecting, people not taking these, different vaccines? Is that something that you all are looking at as well?
Well, I think it's multifactorial, and the report that you refer to mentioned that in the conclusion too. Is there's a couple potential factors. One is we may still be hitting some barriers to getting those vaccines. Vaccination rates almost certainly went down during COVID, and some people may be having trouble getting back in to get them and get caught up. Just the barriers of getting the vaccines is one factor. And then, as we've been hearing about and talking about a lot, is there is some increased hesitancy around vaccines. That started before COVID, but with the COVID vaccines, certainly it got politicized, and so that there is increased hesitancy that we need to address every day and answer those concerns and questions.
And, with maybe that, confusion of whether it's efficacy or side effects or necessity, and or just maybe fear of medicine in general, I think those are some of the feelings too, especially when looking up more on this topic that comes up in articles or different reports.
Oh yeah, it's all of the above. It's concerns about are they really effective? They are. It is concerns about the side effects. There are some, they're minimal, but none of them are long lasting. And so putting to rest some of the fear around them is important.
And in terms of in the classroom, and that's where most of these kindergartners are getting vaccinations for, how difficult, might it be, say, classrooms to have, very high exemption levels? Is that something that is going to affect the school? Is that something that carries to home life and the public back at home? I mean, I don't know what you see here in Virginia, but is that something where it takes from schools and sort of impacts that larger community?
Oh, in many different ways, because any of the illnesses we talk about, one major mode of transmission is crowding situations. whether that be in the classroom where you've got children all day indoors all day long, particularly during the winter months when viral illnesses circulate. We have instances when you put people in military settings where there's crowding, or in college dormitory settings where there's relative crowding. All of those settings increase the risk of spread of these infectious illnesses. That's the importance there. If we have uh, a high enough percentage of people in each of those environments immunized, then we decrease the risk of spread of these potentially very serious and deadly illnesses that we can prevent with immunizations. When the immunization rate drops below what's considered herd immunity, then it allows outbreaks to occur. And that's where we have concerns. And we hear about those published in the news media, where there'll be a measles outbreak here because it got into a group of unimmunized folks and spread within that group of unimmunized folks.
And with that herd immunity, I think the World Health Organization says it may vary by disease, but it's that 95% that you spoke about earlier that, we really would like levels to be at in the United States.
Yes, that's the case. Above 95%, we know we can do a pretty good job. And in that 5% that are unimmunized, you've got people that really cannot become immunized medically. They have medical contraindications to vaccines, and so we'll never hit 100%. But we want to make sure we encourage vaccination in all those that are eligible and don't have a medical contraindication.
Right. And then, in terms of who couldn't get vaccinated, and you just linked one, but the other list goes on, from websites like the CDC and such, weak immune systems, whether they're on chemotherapy, newborn babies for some, and then it's those who refuse or are exempt from the vaccination. So you're saying, it's important to sort of balance out those people who are unable to get the vaccine.
Right, because even in best situations, they still remain unprotected. And it's then when the total immunization rate drops, they become more at risk because they have more people around them that are not immunized and could transmit the disease. So that's just even within the school setting, like you talked about. I forgot to return to your other point, and that is kids take these things home to the families. Multi-generational families, you have family members who may be on chemotherapy and immunosuppressed or fighting cancer, or quite elderly parents or grandparents or great-grandparents in the home that would have serious illness if these illnesses are brought home from the schools by their school children back into the home. So all of that herd immunity and all that cocooning around the vulnerable folks is the importance of getting the vaccination rates up above that goal of 95%.
Right. And this wouldn't be a surprise to those who work with kids or have kids and bring them home, that they bring home even the smallest, illness back home, whether that's hand, foot, mouth, or, strep throat going around the classroom, or the flu. Those are things that kids bring home. So with this exemption in vaccination and possible increase in, I guess, is it risk for getting some of these diseases that we really have put at rest for the most part?
Oh, absolutely. This many years ago in another country, they had a mandated flu vaccination just for school age children. And they showed very clearly that the flu death rate in the entire population, including the elderly, dropped because they immunized the school age children. And then when that mandate went away, those death rates went right back up again. And so we really have an opportunity to save lives and prevent outbreaks and severe disease by getting that 95% or greater vaccination rate.
Absolutely. And that brings us to, I did want to pull the data that you sent us in for these different charts. And please just tell me, which one to pull up on screen here. But just to start, I'll go back to the first one. This is the polio paralysis levels, if you will, after the vaccination occurred in the 1950s?
Right. And so historically, we just lose sight of what we've accomplished. Old elderly folks, older than myself, remember the lines around polio vaccine and all of the people in iron lungs. And that many of these are going to show the same thing. That's just showing that polio has basically almost completely left this country. There was one reported in, I think, the DC area within the last year. And so that's the success of polio. But if we get complacent, if we get comfortable that, oh, it's gone, we don't need to do it anymore, it will come back. And we can be certain of that because it's not eradicated from the entire world.
And what kind of strain does that put on the healthcare system if that were something to sort of pop up again?
Well, for polio, it would be overwhelming because the seriousness of the disease, um, it's not likely to happen, but we can't back away from doing it because it's not gone in the world yet.
Right. And I mean, that carries to, I guess, other, certain, we've seen it with COVID before the vaccine existed, but, the strain in the healthcare system for these other, sort of pervasive diseases or illnesses that come out. I mean, I guess, triple pandemic season, they talk about that word, but, RSV, COVID, flu, whether or not that even is related to people getting all the vaccines, but just in terms of vulnerable populations as well.
Yeah, and I think a good point, we can maybe use one more slide, Sarah, if you go down to
Yes.
the one on measles, I think makes the additional point is, and that is that we know that measles, there we go. We know that measles, you can see in there that they've identified various outbreaks, and that under that red box is the number of measles cases that we had prior to the vaccination for measles and where it's gone down. And what happens is we get outbreaks. And those outbreaks put a strain. Usually it's from a case of measles, frequently from overseas travel. Then they arrive in a community, they get in a community that has less than that 90%, 5% immunization rate, and it spreads and causes an outbreak. And we think, oh, all right, they've had measles. Well, measles can be deadly. It definitely can result in hospitalizations and definitely can result in death. And so that's the importance of maintaining that vaccination rate to help prevent that spread within the primarily unvaccinated populations.
And this is one of those vaccines that's covered in that. Is it MMR vaccine?
Right.
Is what they call it.
Yeah, that's the measles, mumps, and rubella vaccine. So that's the most typical one that we hear about outbreaks. I think there was one in Disney World in California a few years ago. We hear about them popping up at probably every year or so with severe outcomes from some of those illnesses.
Absolutely. And especially, I know that we're mainly talking about kids and it's the kindergarten study, but in terms of maybe going to a boarding school or in terms of maybe then going to college where you're in these sort of tighter knit communities and you talk about, those public places where spread can occur. These are some of the vaccines I think that are really highlighted before kids go off to, college, making sure that you're not going to be able to spread these very, dangerous diseases amongst a larger group.
Yeah, we have additional, there's the kindergarten requirements, which was highlighted in that CDC article that you referred to. But then we also have the 11-year-old vaccines as kids are entering sixth and seventh grade that are part of the school requirements because there's additional risk factors entering in those environments. And then additional ones after 16 years of age to target those folks as they head out away from home.
And I did want to ask you, for parents that are sort of maybe they're with their younger bunch and it's newer to them, figuring out vaccines or whether or not you're deciding vaccines when you enter those different age groups or vaccines come back up. I mean, do you all have advice that you give parents? Do you show them this data and sort of present them if they have questions?
We answer whatever questions and concerns that they can bring up. It's a tell us what you're worried about so that we can address those concerns. Is the approach I take. Um, you know, we just try and alleviate the fears. The importance of vaccines is crucial. One other one that doesn't get shown there that I frequently use in the office is the Haemophilus influenza type B vaccine, the Hib vaccine. When I was early in my career, we took care of kids infected with that bacteria every week with severe outcomes and death. They were in the ICU, they had meningitis, infection around the brain, um, and loss of hearing and that sort of thing. Today's new doctors have never seen that illness. That is the success of that vaccine. If we get lazy and stop giving it, it'll come back. And that's the green line. You see some lines going up there, but the green line is the one that is actually prevented by the vaccine. The other lines are not included in the vaccine, but they're less severe illnesses for the most part in that one slide that you have up there. So that's one of the stories that I give is the impact that I've seen. We do still have children that die from pertussis or whooping cough, primarily younger than 6 months of age. And that vaccine is very effective in preventing that illness. So that's part of the messaging. And then addressing, as you alluded to earlier, that what are the concerns? Is it about the number of vaccines? Yes, we're giving more vaccines than we were 30 years ago when my children were babies. But the vaccines are much more purified and much more protective and much more effective. So we're preventing more diseases with actually fewer things being introduced into the body than we did 30 years ago. And that's an important factor it's hard to understand sometimes as we've perspected and gone into other areas. Um,
And I was just going to say, it's interesting too, because instead of taking the side of here are all the facts, let's debunk the myths, what you said about having parents come to you with those questions that you want to answer them. So you don't want parents to sit back, have these thoughts and not vaccinate their children, but come to you with their concerns and have a conversation about it.
Absolutely. We as pediatricians and family doctors in the communities, please ask us the questions. We just want to have a conversation about it and get you comfortable with vaccinating children, because we're absolutely convinced of the lives that it saves and how we can improve lives by doing vaccinations.
And I mean, I guess one thing going forward, we're always in a constant sort of evolution, I guess, right now, it seems, of new vaccines, of new things that people are trying, new approvals by the FDA. Are there things that you are specifically looking out for, or that sort of at least maybe not excite, but sort of alleviate concerns you have for children right now with it, whether it's RSV or, new COVID vaccine strains? I mean, what are some of those things for you?
I think you've hit on the point of what the opportunity we have this year. It's a little bit limited, but definitely by next year it'll be much higher. And that is, we truly have an opportunity with these new vaccines to prevent three of the most serious respiratory illnesses in both children and adults. These are not school required ones, so this is not the topic of the report where exemption rates were going up and rates were going down. These are not school required, but the ability to prevent or lessen the severity of influenza, COVID, and RSV, or respiratory syncytial virus, cannot be overstated. We as pediatricians are excited about that possibility. It's a new era in being able to keep kids out of the hospital and adults. It was newly recognized. There's an RSV vaccine for the elderly. Newly recognized how much of an impact it has on their wellness as well. So with that good news, we are all frustrated. The new RSV vaccine injection for babies has very limited supply, and so its impact this year is going to be small. We have some, but we do not have much. COVID vaccine has been slow and is slowly rolling out, but again, we can prevent spread to the elderly who will have more severe illness, do a better job of keeping kids in school and out of the hospitals by using all three of those vaccines as they're available.
Right. And so I guess just to ask it in a different way, I know we spoke about this earlier about the impact to the community, but getting the vaccine, it's more than just that individual. It's really that community impact that it has.
Right. And the more people that we have the vaccines, the more we keep people out of the emergency room, when we can avoid the several hour waits in the emergency rooms.
And so you're a doctor that wants to hear those questions, wants to hear those parents' concerns. I guess, what do you suggest for those parents, either maybe listening or just individuals that are old enough to sort of research for themselves? Is it really to go to a pediatrician, a trusted doctor, an expert first, instead of, perhaps Google or perhaps looking at other sources online?
Well, there's a lot of good information out there. And so um, you have to be careful of the source. And if you're going to a trusted source like the CDC or the American Academy of Pediatrics, if you're going to sources like that to truly look at it, that's helpful, and it opens a conversation. Please don't make judgments based upon nuance or opinion, or this individual thing happened to me. Those don't tell the story of the true safety of vaccines.
Well, Dr. Mitchell, thank you so much. I know that there's much more data that we could look at and evaluate here, but hopefully we covered those highlights. But is there anything else, before we end our discussion today that you just want to bring up?
Well, I thank you for your time and getting out this important word. Um, Vaccines are safe. If we did something that wasn't safe, it wouldn't be on the market. We need to have that trust that our vaccine safety system in the United States works. It looks at these vaccines in a very comprehensive manner to make sure that what we're doing for U.S. citizens and the public at large is safe and effective.
Well, Dr. Mitchell, thank you so much again. And with CHKD, there will be an article on wavy.com to follow this conversation where you can rewatch to get more information and also get some links to the report that we spoke about and some of this information to see it firsthand. But thank you so much for watching today. Dr. Mitchell, thank you so much for giving us your time. And please head to wavy.com for more information.
Thank you very much.